New at 5, a stunning reversal from the FDA on aspirin. This affects the 40 million Americans who take the drug as a way of preventing heart attacks.
Now, in a major turnaround, researchers say for the most part, most of those people, the risks are greater than the benefits. CBS 2's Dr. Max Silva is here now with more on what really is a medical bombshell. Doc?
You know, that's right, Maurice and Christine. For years, doctors have been telling almost anyone middle-aged or older to take a daily aspirin to thin the blood. That lessens blood clots, and the vast majority of heart attacks are caused by a clot in a heart artery. What could cause such a major change in medical advice? The risk of internal bleeding. 56-year-old Kirk Devereaux takes aspirin to keep his blood from clotting and protect his heart.
Just a little over a year ago, and they found a major blockage and had bypass surgery.
Devereaux has proven heart disease, and so a baby aspirin a day to thin his blood and help prevent the blood clots that could lead to a heart attack is probably a good idea. But aspirin is a serious drug that also carries significant risks.
Bleeding from the stomach is quite common, more rarely bleeding in the brain. So if you have a low risk of a heart attack, then the bleeding risk may overwhelm any potential benefit of aspirin.
That's what led FDA researchers to upend years of medical advice. After carefully examining major aspirin studies, the agency concluded the data do not support the use of aspirin as a preventative medication by people who have not had a heart attack, stroke, or other cardiovascular problems. Only a select few may actually benefit from aspirin therapy.
If somebody has every risk factor, high blood pressure, high cholesterol, strong family history, diabetes, if you have all those things, you're smoking, some of those people will treat with aspirin, but it's not very many.
Even if you only have one of the risk factors, like a strong family history, FDA researchers say the data do not show a benefit from aspirin therapy, whether a baby aspirin or a full-dose tablet. The bleeding risk is even greater when people take a daily aspirin and then take ibuprofen or other NSAIDs for pain.
If you're in doubt, talk to your physicians. Frankly, you know, self-medication is almost never a good idea.
Now, this advice does not change the recommendation to take an aspirin if you think you're actually having a heart attack. You know, that sudden pressure in your chest, pain in the arm, chest, arm, shoulder, or jaw. This is about taking an aspirin as a preventative if you've never had a heart attack. Christine, Maurice?
All right, Dr. Max, thanks.